17 minutes past 8 now. Mounjaro is one of the so-called skinny jabs. It's being hailed by some as a game changer in helping obese people to lose weight. From today, it can be prescribed by GPs in England.
It was previously available on the NHS, but only through specialist weight loss clinics. But patients are still going to have to meet very strict criteria. Our health editor Hugh Pym reports.
For the health service, addressing the rising level of obesity is seen as an urgent priority. The NHS says weight loss drugs are an important tool to use alongside other support to help some people lose weight and reduce the risk of long-term conditions. The drugs Wegovy and Mounjaro are currently available through specialist NHS clinics in England. From today, Mounjaro can also be prescribed at GP practices and some other community health centres. But there are specific criteria for their use. Patients will need to have a body mass index of at least 40, defined as severely obese. They'll also have at least 4 specified health conditions, such as type 2 diabetes, high blood pressure and heart disease.
This isn't just about taking the drug, which is an injectable. It's also about the additional support the NHS will be providing in terms of healthy eating, good nutrition, physical activity, to make sure that we optimise the benefit of these drugs and make sure that people are likely to get the benefits over the longer term once the weight has initially come off.
There's a warning that prescriptions won't immediately be provided and that people living with obesity who meet the criteria will need to discuss with a doctor whether it's the right treatment. GPs say there are question marks in terms of workload and training to manage the treatment.
I think the real concern is the huge number of people who are going to need help with weight reduction. Many people see Mounjaro as a way of easily and quickly losing weight. It isn't easy, although it is quick. It does come with side effects. And, you know, in order to properly explain all of this to a patient and then monitor their weight loss is going to put a huge burden onto general practice.
Weight loss drugs are available privately through online pharmacy services under the supervision of clinicians. Health authorities say the extension of access on the NHS through high street pharmacies is being considered, but still under strict guidelines. In Scotland, health boards decide on availability of the medicines. The Welsh Government said they were available through weight management services. In Northern Ireland, a specialist service will be launched early next year. Hugh Pym, BBC News.
So that's the detail of the change today. Let's talk now to one of our regular breakfast GPs, Dr. Fari Ahmad. Morning.
Morning.
Nice to see you. We touched on it there. It will be available today, but there are certain very strict criteria. What are those criteria?
So, like from today, I think it's available for people who have a BMI of over 40.
Yep.
And they've also got to have like 4 out of 5 health conditions. So, you know, high blood pressure, type 2 diabetes, cardiovascular disease, sleep apnea and high cholesterol. So there's a lot of conditions you've got to meet before you can have it. So I know we did a quick look, and in our practice it will just be a handful of patients who will meet that criteria.
Mm-hmm.
But are you expecting from
Yes.
from today to be very, very busy with people asking?
I think the message might not be quite getting out there that, you know, there's only a limited number of people who get it. So I would actually, if people can, please don't contact your GP practice. Have a look. So the people who arrange this is your ICB, so Integrated Care Boards. They're the ones deciding how it's rolled out across the country. They have websites and they're keeping people up to date with what they're doing. So find out what's happening in your area and how you access it.
So you say don't call a GP today?
No, because most of the time, so the people who will be eligible for it, we would either get in contact with them once we know how it's going to be set up. Because remember, weight loss isn't just about, like, you know, just have this injection and everything will be fine. We know that when that happens and people stop the injection, the weight comes back on. So you need a wraparound service. So you need to address all the other things that can help. These injections, they're a little bit like jump-starting your car. So your car is stopped, your battery's flat. They help you jumpstart. But then you need to understand, well, why did it stop in the first place? Is the battery problem? Did I leave the lights on? And then you need to make sure you get your car working so you can keep going. So are you going to change your diet and eat well? Are you exercising properly? Is it emotional? You know, I know sometimes when I get stressed, I do turn to food, and other people do as well. So you have to address all those factors for this to work well. So that's what we need. We need that wraparound service to go with the injection. And then that's how you see effective change.
So as we said, it can be prescribed by GPs from today. It's obviously gone through tests and trials to make sure it is safe to do so. But do we know all the implications? Do we know all the side effects? Do we know what it could do?
So we know a few. We do know a few, and certainly it is like, you know, it's not a drug that's been around years. It's relatively new, so we do report things up, you know, when there are side effects we're not expecting, and we are learning more and more as we use it. So there are, you know, it's not for everybody, and there's certain, you know, serious side effects that people can get from it, and the more common side effects that a lot of people get from it. So it's not a thing, well, everybody who has these things is eligible for it. You have to pick the right person, and for the right person with the right support, the effects are great, but you've got to get that first bit right to make sure you get that endpoint you want.
It could be life-changing for someone in a serious health crisis.
Yes, it certainly could. And I have, like, you know, we've been able to prescribe it for some of our diabetic patients who were struggling to get on top of control with them. And for some of them it has, you know, I've seen their journey and you know, but they have been motivated and they've done the side work, you know, they've looked at their diet, they're better with their exercise, and you can see the benefit to them.
I suppose, you know, one of the reasons that it's now available to be prescribed is also to stop people trying to find it online and not really knowing what they're buying.
Yeah.
That's a real risk, that in this rush to get their hands on it, people are buying stuff online that pretends to be these drugs and is anything but.
Yeah. So there are, you know, certainly there are private providers, and there's some who are excellent, some less so. And then there are people who aren't healthcare professionals who may be selling like fake drugs, or, you know, drugs that are not used in the best of manner. And we've had people with side effects from that, with issues. So just be careful. If you're putting something into your body, you need to make sure that it's, you know, the right thing for the right reason. You know, you've been advised in the right way to do it. So yeah, get proper medical advice.
Is there a possibility that people who start to take this might just have to stay on it?
So at the moment, the recommendation is 2 years. To stay on it, to get, you know, as long as you're getting the right kind of weight loss and you have the wraparound care. I think the thinking is that if, you know, when you're on it, you do get better with what you eat, you do get better with exercising, with looking after yourself, then when you do come to that point, you're able to carry on without it. But I think it'll be interesting to see where we are.
Do you get a sense that a lot of people are prepared to do that hard work? Because almost the jab is the easy bit, isn't it? Changing lifestyle, eating a bit less, eating better, exercising, that's the hard bit.
Yes, yeah.
You know, this is a wonder drug only if it's done in conjunction with all the other stuff.
Yeah.
But do you get a sense that people, or certainly the patients you see, are prepared to do that?
So you're right, that is harder to do. And, you know, for years, people have struggled with weight and how do you make all these changes and then keep to them? Because often we're great, you know, we have a few months where we're losing weight, everything's like sailing along, and then, you know, we hit something and the weight comes back plus extra. So I think, yes, people have to be prepared to do the work. But, you know, obesity isn't just us and choices we make. It's the environment and the places, you know, things like town planning, you know, how food is advertised, what can you afford. When I go look at food, I look at packets, I think I'm fairly knowledgeable, but I go, oh, I don't know if this is good for me or not. And, you know, that's the situation in so many places. You know, it's you know, cheap food often isn't healthy food. And there are so many factors that also need to be addressed. So this is one of the ways to address it, but it's certainly not going to be the whole picture.
Dr. Fari, so good to see you. Thank you.
Thank
Good luck
you.
today. Busy day.
Yes.
Nice to see you.